Well, welcome everyone, and welcome to this very important conversation. We're excited to see you. Some of you traveled a great distance and, planes, trains, and automobiles, so I'm really glad that you're here. The genesis of this conversation started between Sue and I, and we had thought, and you need to put this in a timing context many months ago, and we thought that it was important to bring together those folks in a series of conversations that really started this movement and really could help us not only reflect back, but also shine the light on what is the way forward. And so how do we put this into perspective? How do we really understand what we've learned? Because the trauma-informed lens and landscape is very different than it was even 5 years ago. So how do we really think about that? And how do we chart a course forward? However, as we know, our landscape has shifted significantly over the past year. And so as we talked about this conversation, we really felt like we needed to shape it differently. And so although we want this to be a series of conversations, we really want us to focus tonight, too, in terms of how do we think about where we are? How do we take what we've learned and really apply it to the situation that we're in? And how does that help us heal in the way forward? We know that the folks on this call, in this room, on the virtual call with us, has done a lot of really deep thinking about how trauma affects us as individuals, how it shapes the systems that we live in, that we work in, and that those systems perpetuate that trauma. We also know that those systems can heal us, but we have to do that deliberately. And so how do we do that? So as we talked just a little bit, threw off my little talk here, I'm Melinda Baldwin, and I have experienced an awful lot of loss over the past year, having been asked to leave the federal government through a RIF, but was so lucky to spend the summer with CTIPP and to really think about those experiences. The leadership role of the federal government is largely absent at the moment. When I was there, I led the trauma work in the Children's Bureau, which looked at those children who were impacted by the foster care system, and then was honored to lead the Interagency Task Force for Trauma-Informed Care, which was a national movement that really brought lots of folks together across the federal government, and saw how hungry people are for this information, because was asked to go down to the White House and lead that work in the natural disaster space, and how welcoming people were to this conversation. And we were actually talking about, could we have, and I hesitate to even say this, an executive order asking to have a trauma-informed government. That was my dream, and that was my hope, had the things worked out differently. And so I ask that tonight we think about, how do we move this work forward in the environment that we're in, that we recognize how far we've come and how we think about what we can use to move us forward. But rather than focusing on the harms, let's focus, we are amongst an amazing group of heroes at this table. People who have done this work in our communities tirelessly, for so many years, and I know that you will continue to do this work. And so let's relish in the company that we're in tonight, because you do this work every day. And when I start feeling a little bit overwhelmed, you are who I think about, and know that you are out there, and I can pick up the phone and call any one of you, and that you're there. But I also know that our conversations tonight might be triggering. They may be difficult, because some of our presenters are going to ask us to think about some difficult things. So if you feel comfortable, what we thought we would do is start our conversation with just some breathing together. So if you could just find a comfortable seat in your chair, look away from the screen if possible. And I also want to encourage you that if at any time during the conversation you need to take a break, to look away, to use the washroom, to get a beverage of your choice, please do so. But if you're comfortable, close or lower your gaze. And, I thought about doing a more complicated breathing exercise, but what helps me in these moments is just box breathing. And that's my go-to. So if we could do that together. So I ask that we inhale to the count of 4, 1, 2, 3. Hold it for a count of 4, 2, 3. And exhale to the count of 4, 2, 3, 4. And then just hold it for a count of 4, 2. Let's do it once more together, and then we'll do it once more on our own. Inhale, 2, 3, 4. Hold it, 2, 3, 4. Exhale, 2, 3. And hold it, 2, 3. And then just breathe a couple times on your own together. Thank you so much for doing that together today. And so we have a series of folks that will be speaking tonight, and I'm going to ask them to introduce themselves as it's their time, and we'll just kind of popcorn that. But I'm going to popcorn over to Jessie Kohler to give us some introductory remarks. That I planned that.
Yeah, that's my walk-up song. Really appreciate, Melinda, you starting us off. Just everyone being here. I don't have too much meaningful information or content to add. At the perfect time, I want to introduce, keep my phone. So Jeremy Fierstein is CTIPP's new executive director. And will officially be taking over. Thank you. Full-time.
Congratulations.
I guess. Thank you. Officially on Wednesday. Really grateful for the time that we've got to spend together. For the last 5 years, I've had the true privilege of getting to serve as CTIPP's executive director. And throughout the time in this role, have gotten to meet so many wonderful people, including so many of us around the table, including the virtual table, and so many others. And obviously, the last year and a half has been incredibly challenging in so many ways for so many of us, and really all of us, and the movement as a whole. I remember early on, like as Melinda said, right, there is certainly opportunity and hope that we see around the table here today, and as we'll be walking around the Hill tomorrow, right, meeting with legislators of a growing movement, and despite and through the challenges and adversities that we are currently facing. There is one of the opportunities that I see, and as Sue and Melinda were having conversations about what these conversations could look like, as someone who was representing and working for a small nonprofit, there was often a sincere frustration, and this is certainly not to the wonderful individuals who were working from the federal agencies that were doing the work, but oftentimes it felt like leadership of the movement was somewhat misaligned with the values and principles that we were promoting as a movement, specifically collaboration in a lot of ways, voice choice empowerment in a lot of ways, where it felt like there was a lot of a top-down approach. And through the obstacles that are very real and we are facing, and I do not want to downplay, one of the hopes is we engage in more conversations as we work to lift up the incredible work that is being done all around the country, all around the world, in so many different ways, and being able to co-create new shared learning opportunities and strategies as we continue to not just rebuild this movement, as we've talked about so many times, to where it was, but transform it to something even more than it was before. Because I certainly wasn't an advocate before the last year and a half because everything was perfect, right? I think that we all know that there was opportunity for growth, and that hopefully through these obstacles, through the adversities that we're facing, there is more opportunity to transform the ways that systems operated to be more in alignment. And one of the things that needs to happen is shared conversation and communication and learning through that. And so we are very much hoping that that today's launch of this conversation, tomorrow's Hill Day, with a lot of activity, a lot of steps for those of us who are in DC, and a lot of good conversation and learning, and the many conversations that are going to emerge from this Thursday, Friday weekend that we're spending together will continue to grow out. Today, I will just quickly introduce, not do enough justice to any of our wonderful speakers, but we're going to spend about an hour or so hearing about from Samantha Corey, from the Institute on Trauma and Trauma-Informed Care, about kind of the state of trauma-informed practices in the field. Whitney Marris, also from the Institute on Trauma and Trauma-Informed Care, about policies, trauma-informed policies from work that is now a decade old, and tracking policies that have been passed and sort of the current state of affairs, if you will. I don't want to call it a State of the Union because that now is not as pleasant a thing for me. Sort of what we're doing. And then we will also hear from Dr. Sandy Bloom, who is up on the screen with us, about the history of the movement, and also from her incredible wisdom, some of the opportunities that she sees for moving forward. And so, again, that does not do nearly enough justice to the three wonderful presenters that we are about to hear from, but hopefully creates a container for this first conversation that level sets where we are as a field, that we can then engage in conversations from. Again, folks that are in the room will have opportunity for questions and conversation, so please feel like continue to take in what's being said and be ready to share, converse, communicate in the room. And then folks in our virtual room, again, please feel free to use the chat, and we have someone actively monitoring the chat. And after the three presentations, we will get to sharing conversation and really launching that part of it together. So that's enough from me for sure. I will turn it over to Samantha if we want to do a quick slide so that way you all we love chairs with wheels.
Very helpful. All right. Well, good evening, everyone. Thank you so much again for being here. As you heard, I'm Samantha Corey. I'm one of the co-directors at the Institute on Trauma and Trauma-Informed Care, and I've had the pleasure of being there for almost 11 years now. And so we are part of the University of Buffalo School of Social Work and Buffalo Center for Social Research. And we do a lot of different things, but our primary work really is that we contract with agencies, organizations, systems across sectors to help them move through the trauma-informed organizational change process. So certainly we do a lot of training, but we also do evaluation, consultation, coaching, and we do a little bit of some of the direct client work, but not as much. So I am here to start us off in terms of inviting us to think about the current state of the field, if you will. So a little bit from an academic standpoint, but certainly our practice-based experience from being in organizations and agencies echoes a lot of what the academic literature, if you will, says. So I will be talking a little bit about that. And I do think I have a couple of slides that are being shared. So a couple of things that I asked us to... Are they on?
Can folks on the screen see slides?
No.
Oh, eek.
We need to set permission to.
Do you guys have an extra? There's a lot of that stuff happening. It's okay. A couple of things that I'm going to invite us to think about in terms of the context for today around this idea of trauma-informed care, trauma-informed approach, based on our folks here had some opportunity to talk before today's conversation. And the first thing that I want to make comment to is, like, especially as we move into the field about where we're going, recognizing that, again, many of you know this already, the difference between the trauma-informed approach and trauma-specific treatment, right? And so for us at the Trauma Institute, we really talk about trauma-informed care or trauma-informed approach as the new universal precaution, right? And so thinking about how similarly to when you go to a doctor's office or dentist, whatever, they put on gloves before they touch you, right? They don't ask you, do you have this infection? Do you have this going on? They just put on gloves just in case, right? And so that's referred to as universal precaution. Similarly, this trauma-informed approach is not specifically about treating trauma. That's a small component that certainly is part of this larger conversation that we're having. But we're really recognizing that the way that we do our work as individuals, as teams, as organizations, as systems, certainly communities being part of that, we put metaphorical gloves on in terms of being very intentional about the way we do whatever it is that we do with whoever we interact with, just in case. Right, the goal is to prevent doing additional harm. We want to try to avoid re-traumatizing individuals, right? And so a key piece around that, and certainly you're going to hear from Dr. Bloom in a little bit, right, that she really invites us to consider this idea of parallel process. Right, so if the goal of many of our organizations and systems certainly is to respond to the clients, the patients, the students, the community members, organizations are like living systems. And so we need to have alignment around certainly the way that organizations function, thinking about the interactions between leadership and the workforce, workforce to workforce, workforce to client. We need to be aligned with these values and principles of the trauma-informed approach in order to truly engage in universal precaution. So as we're having this conversation, certainly lots of folks here from lots of different spaces, thinking about the work that you do, and some of that might be micro work, direct work with individuals, but thinking about your team, thinking about the organization, the larger service sector that you're in, certainly the community and the larger government's part of the conversation as well. So just be anchored in that conversation as we are moving forward. And so this really is, we say, and it's a little bit corny, like this is a journey, not a destination, right? This is a long-term, multifaceted process. And, you know, this screen that's up on the screen now is an image that we use at the Trauma Institute, is it really is the overarching umbrella for what we do, whatever it is that we do, guided by certainly the trauma-informed values and principles. And part of what I will talk about in a few minutes is the need to integrate diversity, equity, inclusion, accessibility, and justice into that piece. So that's what we'll be looking at. So, and excellent. Okay, thank you. Cool. So, not sure why it's not. Oh, there it goes. Technology, and it's a little wonky. So sorry that it's showing up funny. So, what's really been interesting, and again, I acknowledge that there's many people in this room, in the virtual room, that have been doing this work much longer than I have, but even in the 11 and so years that I've been doing this, like, what a tremendous growth we've seen in this movement in terms of moving from trauma-informed care being something that's in the mental health, behavioral health world, right? And so the graphic that is on the slide here is intended to really demonstrate that this is across sectors, that this conversation around universal precaution, trauma-informed approach, sometimes trauma-informed medicine, trauma-informed educational practices, trauma-informed policing, right? We say trauma-informed approach broadly to encompass these pieces, that service sectors have taken this and run with it in terms of, okay, so what does this mean for us, right? And so we think that that is a very cool thing to see. And so the colors that are on the screen here, those that are in the pinkish color have arguably more literature support in terms of more articles and publications around what does this look like, specifically at an organizational system level, right? So healthcare, K through 12 education, certainly mental behavioral health, addiction, child welfare are leading sectors in terms of, again, the literature. But there's some other really great work also happening in terms of some of the other boxes. And so you may not be surprised to see early childhood and housing, higher ed, the justice system, intellectual developmental disabilities is the IDD, first responders, and I was pleasantly surprised more recently to see, speech language pathology as well as libraries and some sports athletics, right? And so this is growing, right, in terms of thinking about this truly is a movement. And so part of what I want to share, though, in terms of contextualizing some of the challenges that I'll be talking about that the field faces, and certainly thinking about future directions, is that a lot of the literature that's out there is very conceptual, meaning that people, many people that are sitting around the table on I was going to say Zoom, but Microsoft Teams call and other thought leaders, right, have spent a lot of time operationalizing, like, what does this mean? What does this look like in different systems? And so that's great. We need the theory, we need the concepts in terms of thinking about what that means, certainly at an individual level, but for organizations and systems. I would say the next tier, if you will, of lots of literature is looking at training interventions, right? And so people are publishing on a group of people, whether that's nurses or teachers or whoever, get some kind of educational intervention on what trauma is, thinking about being trauma-informed, and usually short-term impact of that in terms of change in knowledge and attitudes. There's been a number of evaluation tools, assessment tools that have been developed, and many of which have been validated in terms of how do we think about organizational change for this trauma-informed approach. Certainly there are some models for implementation. I'll make comment to that shortly. And the smallest percentage of the literature is truly like the actual implementation case studies, looking at outcomes, does this work, right? And so again, the movement is growing and we still have plenty of work to do for sure. So that will be part of what I will talk about. So on this next slide, we are looking at a couple of different things. So at the Trauma Institute, we have our own organizational change model that's certainly been based in the work of Dr. Bloom and Roger Fallett and Maxine Harris and SAMHSA and others that folks certainly are familiar with. And so I have done some work over the last couple of years in terms of trying to keep tabs on the literature, if you will, on trauma-informed organizations. And so as of this week, there are 85 sources, 77 of which are articles, research articles, conceptual, a lot of them. And then there's also 8 different implementation guides that at least are focused on some aspect of looking at trauma-informed change at an organizational level. So not looking at trauma treatment specifically and not looking at just doing training, so that there is this larger acknowledgement of the context. And so what I have done in terms of this bar graph is I was tracking, they're not necessarily using the Trauma Institute's language, but tracking like what are people saying are the important elements of what it takes for an organization or a system to be trauma informed. And so this bar graph shows that the number of those sources out of 85 that these types of things are referenced. And so what I'll point your attention to is that there are 85 sources and none of these areas have an 85, meaning that there is not one element that every single source talked about as being a common piece of what it takes to be a trauma-informed organization. So I find that interesting. But the top couple of areas that were of focus are probably not surprising to most folks that have been doing this work. The first of which is training, right? That the workforce does need to have education and honestly ongoing training, consultation, coaching on what it means to be trauma informed in their role. And so that's more than just having some trauma awareness, right? So the literature has been pretty clear about like, this is not a one and done lunch and learn type thing where people get some basic information on trauma and ACEs, that it is, a process that people need some common language, but there needs to be reinforcement, right? So that's good to see. And then I was also pleasantly surprised that reviewing policies and procedures, meaning really paying attention to, again, the way organizations function, how we do business, for lack of a better word, is also up there in terms of 63, following training that had 69. So that was good. And then after that, we are looking at actually addressing the impact of the work, which, again, fills my heart with a lot of love is probably too strong a word, but in terms of the workforce is something that I am very, very passionate about, in terms of acknowledging that the work that so many of you do, even in this room and in the virtual room, like, it takes a toll, right? When you are present to people who are experiencing trauma and adversity, the idea of vicarious trauma, compassion fatigue, moral distress, right? Different pieces that the organization does have some responsibility to do something to mitigate some of that impact. So those were the top 3 areas. Certainly you can see some of the others. I was hoping that leading and communicating, meaning leadership, investment, and leading this work is really important. It's not as high as I would like to see it being, but it's up there, right? But then you can also see, like, how do we pay attention to, like, human resource practices? What's the experience of the workforce? Certainly, how do we think about safe environments is up there pretty high. There's certainly screening and treating for trauma. I think there's been an increase in the last couple of years, specifically around this idea of how do we promote cross-sector collaboration? How is it that we manage, having referrals and tapping into the fact that one organization does not do all the things, right? So that has been increased since when I originally made this graph back in 2023. And interestingly, and I think appropriately, this idea of how are we involving people who are receiving services, clients, patients, students, community members, in the actual trauma-informed organizational change process has been something that is also a common element that is increasing. And so I do want to comment that certainly this is limited by the fact that I only can read English. So this is looking at English publications, but there are certainly lots of United States, but also Australia and the UK and thinking about Canada for sure. But there's also other countries like Japan and Egypt and, Africa, other spots that do have publications in English as well that are available in very similar type conversations. So just like things to think about. All right, so I am going to make a couple of comments about some current challenges. That's okay, you can leave. Thanks, Jesse. In terms of thinking about certainly where we're at as a field, based on certainly literature support, but also honestly what we see oftentimes at the Trauma Institute. And the first one really being this idea of our field of trauma-informed care struggles with having a lack of common language in terms of people will oftentimes use terms to mean the same thing differently, but sometimes the same thing. There is not one universal definition of trauma. There is not one universal definition of what it means to be trauma-informed. All right, and so that causes issues in terms of being able to have conversations. It also causes issues in terms of being able to evaluate and make sure that we're looking at the same things. But people will then also not necessarily know that we're using the terms to mean the same thing. So people call things trauma-informed, trauma-responsive, trauma-sensitive, trauma-aware, fill in the blank, right? And sometimes, again, like I said, they're used interchangeably. Sometimes they're not. They're not meant to be used interchangeably. And so if we are going to move forward together collectively as a movement, we need to be on the same page about what we're talking about, right? And so some of that is because we don't have one model of trauma-informed care. And I'm not necessarily suggesting that we need one model. We have various sectors that are involved, and yet without some level of operationalized practices in terms of really what does this mean, we are going to continue to struggle with not being able to evaluate what it is that we're doing to be able to demonstrate that this actually works in a way that we all in this room know it works based on doing this work in different capacities. But we know when we talk about funding and policy and other things, people want to know, so does this actually work? What kind of outcomes does it have? And if we're not measuring the same thing, because we're not talking about the same thing, that causes challenges, right? The piece around that in terms of thinking about this is that, trauma-informed organizational change is organizational change. So things need to be adapted and tailored to the specific agency and organization that we're looking at. So there's some, strength in trauma-informed change to be able to do that, which is why a lot of the models out there have broader conceptual guidance, theoretical guidance. They have areas, again, we were just looking at some of those big picture areas of policy and environment and those kinds of things. But again, because that looks so different in different spots, even in two schools, right? It could be two elementary schools, it could look very different. That causes, again, issues because we don't have standards, we don't have benchmarks, we don't have those pieces. So that's something for us to think about. And so the other issue around this is that there are many barriers to organizations sustaining this work. Right, so doing it, implementing it, and sustaining it are challenging because it is a multifaceted approach. It takes a lot of resources and time. And so really there are many things that organizations share about why this is challenging. And I'm sure folks around the table can agree in terms of, all right, we got competing priorities, there's not enough time. Staffing and turnover has been a very big thing, right? An agency invests in getting staff trained and people leave, and now we got to start the training process all over again, right? And so those kinds of pieces make it hard to keep this going. Thinking about funding is also an issue. Being able to bring outside consultants or experts in to do this work is not always possible for all organizations, right? And consistent implementation and application, especially in larger systems, can be hard. Pockets of the work can happen, but doing it consistently is challenging. So the last couple of comments that I do want to make in terms of this next circle, thank you, Jesse, in terms of the lack of empirical support. So I started making comment to this already, like there are real, what do I want to say? Justifiable is not the right word. Reasons why there is a lack of empirical support. Until we can address the common language issue, it's going to be hard to get to the point of the empirical support, but it's also hard to measure organizational change and know which specific strategies that are being implemented are what creating the outcomes, right? And so the plus is trauma-informed care does have some evidence base, right? That this is an important piece that does have positive impacts, especially on the workforce, in terms of thinking about things like organizational commitment, self-reported burnout, compassion fatigue, those kinds of pieces. There are some like client, patient level outcomes in terms of satisfaction and other types of things. But our field does struggle with a lack of long-term outcome studies. Again, part of that is because of the lack of common language. Part of that is because we have had a growth in actual evidence informed evaluation tools over the last even 5 to 10 years, so we can better evaluate some of these things. But some of it is just, the studies that are out there don't have rigorous experimental designs. They have small sample sizes. And again, because we're talking about organizational change, it's hard to be like, well, it's because we did this that this specific thing over here is happening. And so there's a need for implementation science, looking at complexity science, those types of pieces to be able to build the support. And the last challenge, which is not necessarily a challenge, but something for us to think about as this conversation goes forward, is that most papers these days really highlight the need to pay attention to integrating diversity, equity, inclusion, accessibility, and justice, anti-racism, right, into this work in terms of what we know about historical trauma, systemic trauma, those pieces. But it's still very conceptual in terms of what that actually means. And so there is a need to talk again specifically about how do we operationalize this? Like, what does this actually look like? Certainly at an individual level, but also at the organizational level. It's one thing to say, yes, we need to review our policies to be trauma-informed and in line with DEI, but what does that really mean, right? And so it's part of what we need to pay attention to. So a couple more comments and then I'll pass it over to Whitney in terms of some things to think about. And so these future directions do come from recommendations from folks that have certainly published on many of these things that I've been talking about very briefly, but certainly some of the conversations we've even been having internally at the Trauma Institute and with others. And part of what informed this conversation today is really thinking about, like, can we move to a place of having individual and organizational either benchmarks or standards or competencies? I personally don't think that there's ever going to be one uniform model of trauma-informed care, yet I think that there's work we can do in terms of, like, all right, so what is the standard? What do we need to at least look at? What's the benchmark? How are we able to have a common language around, like, all right, if someone says that they're confident in being trauma-informed as a nurse, as a teacher, as an agency, what does that really mean? So that people have that common, like, okay, we got what that means. Certainly many spots are thinking about, it's hard to train the workforce when they're already out in the workforce in terms of resource capacity. So how are we building this into training programs in terms of schools, professional schools, graduate schools, et cetera, across sectors. So this is not just a social work thing. This is not just a nursing thing. This is not just a teaching thing. So how do we integrate some of this more? And that has been happening in lots of ways. I'm sure Whitney will comment to that a little bit. I already made comment to need long-term outcome research, right? Our field is beyond the point of conceptual theoretical literature, which is fantastic, right? I think it's a testament to a lot of the great work that's being done. So now we need to demonstrate that this actually works, right? So how are we as organizations, as people committing to evaluation and research around this? Communities is not my field. Certainly many people around this table are much more in tune with community work, but there is a need for continued development around trauma-informed networks and communities. And then certainly, and maybe most importantly, as Whitney's going to talk about, like how are we continuing to move the needle around federal, state, and local policy and funding to support this work? Again, there's been so much work that has happened based on people believing in this and wanting to make this happen. And if we're going to sustain this movement growing, like we need funding and support. And so the policy piece is partly how we do that. So I will stop talking now and ask my colleague Whitney to make that. Thank you, Pam.
Amazing. Thank you. Yeah, we'll do a switcheroo. What a beautiful bridge builder you always are, Sandra. I really appreciate that. We're going to do the switch. And apologies. Thanks, Jesse, for pivoting in that way. I thought I had the power to share, and I didn't, which we can use as you try to do this. We can use as an opportunity to talk about the fact that there's a whole advocacy series available on CTIPP.org. There's a whole module about power and the use of power and building collective power. Right? So for me, the story here today was, oops, I thought that I had the power and I didn't, but we hope that it's the reverse Uno for you today, right? Maybe you're thinking you didn't have the power, you don't have the ability to make a difference. Maybe you're feeling moral distress, maybe you're feeling paralyzed, right? Our best hope is that as we come here together for this activity, for these days together, in solidarity, that you emerge feeling like you have more power than when you arrived here today. How'd that go, Jesse?
Your beautiful title slide is the only slide that is not loading.
Oh my gosh! Well,
so, but everything else is. So
sweet.
I will go.
Well, I will give you. It's a beautiful cloudscape. This is the alt text for the image for those who do universal design for learning, which we all should be doing because we should all be thinking about accessibility. And it's a beautiful cloudscape with the sun coming through, peeking through, and it says trauma-informed policy. Progress, promise, pressure points, and possibilities. we like alliteration. And 2013 to 2025, because that is 12 years. This is the amount of time that trauma-informed policy has been in the landscape, right? That there have been any sort of, ooh, hooray, there it is. Did I do it? Thank you so much. Yes, I can do that myself. Excellent. So, in terms.
Oh, shoot, they want the first page. Back one.
Okay, yes.
There you go.
A little bit of a lag.
There's a moment.
There's a little
So beautiful.
there right there. In the sky.
That should be one of the Smithsonian's.
Yeah. I appreciate that.
And you.
And so Samantha builds a beautiful bridge for this, right? In terms of what even is trauma-informed policy. And at the end of the day, there might not be a significant sort of agreement around this, yet what we know, right, is people like Melinda have co-created at SAMHSA these beautiful frameworks, these principles, these organizing ways of thinking through this model. There are skills that we can enact on an individual level, and they all are about carrying forward these principles, right? When we think of what is trauma-informed, we have this sort of 4 R's model, right? We realize, we recognize, we respond, and we reduce re-traumatization intentionally. And so that's kind of the what, but the principles are the how, right? They're going to look different. They will look different in context, they will look different in relationship, they will look different across a whole spectrum of qualities that you might encounter in policy, in your communities, in your relationships. And so what's really important is to remember that they are anchors, right? We can organize around these anchors. We can see the presence of safety, trustworthiness, transparency, collaboration, mutuality, peer support, empowerment, voice and choice, cultural, gender, and historical context. These things are incredibly important, and they do intersect, right? It doesn't necessarily have to be silos for these. But this slide captures some of the ways that we see these principles coming together in ways that can mitigate the impacts of trauma. It can prevent trauma from happening, right? We are looking through a prevention lens, and you'll see that on there, prevention versus reaction. We see what happens when we wait to respond. We see what happens when we try to hope for the best and close our eyes, put our heads in the sand, turn away. We need to turn toward, right? We need to be looking toward prevention. We know the science. That's one of the things that I think is so important, right? Is that some of the science we do know, and it is that there are things that we can do to mitigate these impacts. There are things that we absolutely know works to be able to do better than we're doing as a collective, right? And so that's why we're here, right? The coordination versus fragmentation, you spoke to that beautifully too, Samantha, right? So much fragmentation. And so how beautiful that we come here together today, right? Aligning, trying to find a shared language, trying to find shared values and that alignment. And that's something that, yes, we are doing that here today. If there is one thing that you take away, please bring this into your communities. Please bring these conversations back with you that you have here, right? We are a small but mighty group, and also this cascades, everything cascades, right? We think of this idea of Ubuntu, I am because we are. Each of us has the power to influence one other person, each other along the way. So everything that we learn here today, I hope you'll bring back, because that coordination isn't happening at the parallel, right? There are so many fragmented things happening. And so bringing that together, lived experience leadership versus compliance, right? We see this all of the time. These institutions say that they're trauma-informed, and who is the helm? Who is at the helm, right? Who is representing the people in this country in our current government structures? Who are the faces that these kinds of policies are being attributed to, and who are the people who really are impacted by them? So really thinking about engaging people differently, right? And there are different policies that you'll see, and there's a companion document that if you're in this room, you'll have access to tomorrow. And I'm assuming, Laura, you're on there somewhere. I know you'll have this available for them, for people who want the resources afterwards. Laura is CTIPP's wonderful communications director, and I've got a booklet. I've been tracking this. I'll get to this later, spoiler alert. We have a little bit of history coming up about this document, but I've been tracking this policy for almost 10 years. And so it didn't start with me, but I've taken this on, and what I've done for this essentially 10th anniversary is there is a page for every single state that chronicles all of the action. I've taken a framework that I'll talk about in a moment that is CTIPP's vision. There are 16 different dimensions, because we do need to be able to put some sort of structure to this, to be able to conceptualize it. Otherwise, we're all going to be trying to wrap our heads around it while they are devolving our government, while they are devolving our society. Right? So I'll talk about that in a minute. But you'll have access to that document to really see what these look like in action in your state and other states at the federal level. There's so much information out there, and I'm hoping that something will resonate with you, right? There will be something that you found that you didn't even know was a policy proposal that you leave here today thinking, like, that is the thing that I want to put my effort toward, because we can't do it all, y'all, right? We cannot do that. We have to take care of ourselves. Speaking of that parallel process, taking care of ourselves, advocacy is really hard work. Trauma advocacy is really hard work. So an invitation and a reminder as we dig into this gargantuan challenge that we are all coming together to tackle. And again, relational integrity, procedural compliance. This is a relational thing. We know healing happens in relationship. Trauma happens relationally, right? So why wouldn't healing also happen in the context of healthy, consistent relationships over time? And we can hold that space for one another. We can hold that space with people we might see as adversaries by being curious and compassionate and spacious to be able to have that relational connection, because you never know what seeds you plant might germinate later. The systemic integration versus these programmatic add-ons, I think you spoke to that as well, Sandra, right? Like this aspect of, let's not just do one more thing, let's integrate it into there. Let us make this a part of the infrastructure, the very bones of the organizations and systems of care that we trust with our human beings, that are our community members, our friends, our colleagues with, right? So thinking about the integrative pieces of that, how do we bring things together instead of continue to fracture them, right? Because things are too fractured. We can be connectors. Trauma-informed care is connecting. And accountability versus diffusion of responsibility, being able to be radically honest is a part of this work, right? To pretend that what is happening is not happening is absurd. It will not solve problems. It will not lead to trauma being mitigated. It will not lead to trauma being prevented. It will lead to people being harmed. And so being honest, having these conversations like we're having today, thank you so much, Melinda, for anchoring us in a self-regulation exercise, because yes, it is scary. There are things that are uncertain. There are things that are difficult. And also, we get to co-create together to think about what we want our future to look like. And we can make choices along the way. There are so many choice points along the way. And it doesn't have to be the most sweeping, enormous gesture to really matter. All of you being here, screen, human, all of it matters. And I'm just so grateful to be with you today in that. And then thinking the long game, right? The arc of justice is long. We know this. And so really remembering that in these kinds of moments where they don't want you to remember that, they want you to disconnect, right? They do not want you to think that there is something on the other side of this, but we will prevail, we always have. And we can come together to talk about what that looks like, and we can create that together. And so that's why we're here today, right? So thinking about the ways that this began through these mentions of like trauma-informed care. What even is that? Let's put that in the legislation. Let's start to sort of consciousness raise, right? It starts small. It starts with the language. And it started in only a couple pieces of legislation first in 2013. And as we have grown this document for ITIPP, the Institute on Trauma-Informed Care. You're going to hear a lot of acronyms. There's just so many acronyms in this work. I don't know why. But the document began with just sort of like we were chronicling everything. And this, again, did not start with me. It started with Rachel, one of the interns at the Institute on Trauma and Trauma-Informed Care. And it was maybe, a 10-page document for several years because it was slow going. But how beautiful that it was slow going. That is progress. That is something. That is not nothing. What a delight, right? So imagine our surprise when I'm there as an intern also, and we are tracking this, and it is becoming hundreds of pages. My Microsoft Word is like struggling. I'm hitting that rainbow wheel, and I'm like, oh gosh, I hope this saves. And then it doesn't, and I'm like, well, okay, let me do it again. And so everything has to have a separate document now, right? It's 200 pages. Is this year's alone? Amazing. And this again, whether or not these measures are being signed into law, it's amazing when they are, and also this is conversations, this is progress, this is the amount of policies that actually get signed into law is something like 3%, right? So you'll see cycle after cycle persistence and resistance of people continuing to put this out there, right? Continuing to put this out there and talk about these things using the language. And so as the document has grown, as the space has grown, that is a big delay from when I heard that. So as this has grown, right, these are kind of the arcs that I was noticing in this 10-year analysis. And again, it's hundreds and hundreds of pages of documents. It is years of different proposals from all different ways of thinking about trauma-informed care. And these were sort of the umbrellas that I was able to analyze from this. We have these early trackings, right? And they're kind of the usual suspects, right? Like child welfare, we can all get on board with that. Everybody cares about children, and that's a beautiful inroad. And so that is where we see a lot of this starting to, under the surface, sort of bubble up, right? We think about child welfare, we think about average childhood experience awareness. These are the places where seeds were planted, and it started to be institutionalized and enshrined in law to pay attention to these things that, again, we absolutely know, even if it is a public health schematic and not an individualized experience piece of evidence to say, oh, well, someone has ACEs and therefore ABC, XYZ, right? We can zoom out and know collectively. We see the collective impacts of this. We know this, right? And so being able to make those connections to adverse childhood experiences as a public health idea of noticing the social determinants of health and how they connect, noticing all of these different domains of life that are connected, it really opened a door for us to move into that next arc, right? That sector expansion where we're looking at more sectors and systems. I will say they were very siloed. It was very much piecemeal, right? But it was still chugging along. And then in 2020, we all know, right, that there was such a seismic disruption of our society that even though the trajectory had been more moving toward prevention, we had to sort of pivot and be reactive, responsive to what was happening, right? And it was one of the first times that we really saw people using this term, trauma-informed, understanding in their bones viscerally what that really means, right? Because yes, we need a definition, and also our bones know, right? We know what this feels like. We know what this is to live in this legacy of trauma. Many of us intergenerationally, many of us ancestrally, right? Carrying heavy burdens. And so really noticing that shift as we all sort of had this collective experience of unsettling and disruption, being able to plug into our own humanity is such an important piece of this, to turn back toward ourselves. We see that afterwards, there is this syndemic response, syndemic being sort of the coupling of so many different cascading impacts from a pandemic that then touched on so many other domains of life and human well-being. And so the different types of responses did expand after that sort of reactive and responsive period of time where we were in the peak of COVID, right? And so we started to see, wow, this is related to this. Oh, children are not able to learn. And I see how that impacts that. And I see that those parents were not able to be home. And I see the moral distress that this causes. I see how that changes their identity. I see how this changes communities. We could see it more clearly, right? And so as that all came together, here we are, 2023 to 2025, we are starting to see more system integration. Asterisk, there are other things we're starting to see that I will speak to later as well, but really noticing, right, that we are noticing that there are interconnections. These are not siloed things. This is not a clinical thing. This is not therapy. This is everything, right? This is process, not outcome. And so being able to look at this policy document, I don't know, right? It's wild. It's just absolutely wild to think about. And to the point where my inclusion criteria completely changed, right? If I were to include everything that just said trauma-informed, it would be a document that would not be useful to any of you because it is everywhere, which is delightful and also is it becoming performative, right? So we look for more meaningful alignment. We say, this is a model piece of legislation. Advocates, please, this is a great start. Here's where you can build on this. Your legislators already care about this. They've demonstrated it. This is the language to use. Here are the places where other states have noticed this connection. Here's the data that we have, right? And so being able to look at all of this data, I can't even tell you how much weird institutional knowledge I have at this point, just like in my noggin. And it keeps me hopeful, right? Because I see that even if it feels slow sometimes, it is incredible. Now you do see that sort of downswing in the recent years. And I mean, it's a hypothesis. This is not a research asterisk. Don't like quote me and say, don't cause a scandal about me being wrong. But I think I have to think, right? Like there's a reason that downswing happens when we are all feeling absolutely incapacitated, unable to make a difference. Legislation is not passing. There is partisanship and discord and separation that is preventing action from happening. But to see that upswing, right? To notice that that's been there, and to understand what this needs to be met with in terms of this sort of collective disconnection, which Sandy Bloom will speak to you later and really dig into, right? The sort of living systems that continue to perpetuate these cycles and the ways that we can disrupt them together. Just noticing, right, that there is so much that has happened. And what I'll say is when you start to look at the states over time, in New York, California, Illinois, New Jersey, Washington, Hawaii are really sort of people that have been doing this for years and years and years, leading the charge. And there are others that are coming forward as well as complete stars in this space where their legislatures are really paying attention. And again, you're going to have this document that has every single state and also has federal information and then has some overarching findings. So if you're curious to know where your state is, you'll have some more information about that tomorrow as well. But for now, one of the organizing frameworks that I really encourage you to think about and take a look at if you sometimes have trouble wrapping your head around what trauma-informed means, where do I start my advocacy? I care about so many things, cosign, subgroup, right? So many things to care about and so much humanity to preserve so we can be advocates and useful to our relationships and in our lives and to ourselves, right? And so I sort of tracked the ways that these 16 dimensions in what is called CTIPP's vision for a trauma-informed future. It is something that when I had the great privilege of being the founding director of trauma-informed practice and system transformation for CTIPP, as I had done this document with the Institute on Trauma and Trauma-Informed Care for so many years, I finally had the time and space to have a role that was dedicated to thinking about how this all fit together, right? And so I found 16 different dimensions, not silos. They are not necessarily sectors. There are intersections around them, right? It is not public health and medical and legal, right? It is different. It is all of these interconnections, and they are process oriented rather than outcome oriented. And what I'll say, right, just to have a North Star, notice what's on this slide. We see that some, again, might be more accessible, more sort of socially acceptable, more digestible, and then some on the right side are still emerging: climate and environmental justice, end-of-life experiences, right? Really important things that we are seeing in our society as critical issues that still are yet to appear in the legislation. So again, this is just a high-level overview, something for you to come back to and really think about, right? These are the areas that have been successful. These are the areas that need you. We need you so much in these areas because these are all interconnected to some of the others as well, right? And when you plant seeds in one, oftentimes it will germinate in another or will model a change that can happen in another. So those dimensions might just be useful to you if you're somebody who, like me, sometimes really does have trouble figuring out that starting point for your advocacy. And then in terms of what moves and stalls, right, when we look at the trends over the course of this 12 years of legislation, we see that there are certain things that are more easy to sort of get over the finish line and some that are more controversial. And again, I'll speak to the sort of current context in a moment. But this is a scoping overview, right, of the last 12 years. We see training is something that is pretty digestible, and that is something that moves outward. What I'd encourage you to think about is how can we then integrate peer support principles into that, if it's not already, right? How can we think about empowerment, voice, and choice? How, when there are training mandates, can it not just be clinical staff? How can it be everybody? How can it be that universal precaution that Samantha spoke to earlier, where every single person is putting on their metaphorical gloves and engaging with a little bit more space and compassion for the idea that somebody in front of them could have experienced trauma? And so again, I'm neurodivergent, so noticing patterns is like a thing that I'm very, very good at. And so I would say that there are many more than this, but these were some of the things that I was able to take away, right, from this scoping review. In the terms of the barriers that we see, these fragmented systems that we spoke to earlier is important, but that the policies without resources, right? There's these initiatives launched, and they are beautifully received by the community. People benefit from them, but they do not have sustainable funding. They're pilot programs, right? They're temporary tests to see, oh, let's just do research here and see. And then the services get taken away, the resources get taken away, and we have data and people are harmed, right? So really thinking about some of these policies, some of the reasons that some of them might not be sustainable is because they aren't thought of through a sustainable lens, right? So really bringing that lens to when you're doing your advocacy work, really encouraging people to understand that it's sometimes more harmful than helpful to have temporary experiences where people get a taste of having access to something that then gets taken away from them. That's re-traumatization, right? And when we think about trauma-informed care, what it really is about is operationalizing these principles to reduce the likelihood that re-traumatization will occur, right? So if you need sort of a talking point for that, that is it. It's about re-traumatization, right? And we have the power to be able to make choices to engage differently to reduce that. We can't predict everything, we can't prevent everything, but we can make those choices individually and collectively in our leadership roles, in our workplaces, in the institutions that we work with, in our communities, in our relationships. And so there are some places that I do want to uplift. We see this happening, and I think this is really important to be talking about when we were talking about radical honesty. There are fractures to even establish trauma-informed law that I'm seeing happen, and I'm seeing it happen in the last couple of years. And one thing that we see is in Kentucky, for example, there is a policy that was passed, and I speak to this in more detail in the document, but the TLDR of this is essentially, it's too long, didn't read of this, is essentially, right, at a high level, just 2 years earlier, there was a trauma-informed provision that went through and signed into law that just 2 years later was being completely gutted because it was including diversity, equity, and inclusion language in a trauma-informed frame. And essentially, they were trying to, and it did not pass, right? This did not prevail. So it's good that we are talking about and looking at this because it could slide under the radar, right? And yet it did not prevail, but there was an attempt to take out language that just 2 years earlier was established in schools, in communities, as being a great decision, right? So it's interesting to think about that. I think we can all sort of speculate and wonder why that would happen in just 2 years, where suddenly this provision that was supportive to the same legislature is no longer feeling supportive, right? They now are saying, we can do trauma-informed care, but you can't have any of this language, you can't have any of this sentiment. And as Samantha beautifully spoke to, right, cultural, gender, historical issues, ABDEIJ, accessibility, belonging, equity, inclusion, justice, anti-racism, all of it is important, and it is integral. It is not just important. Let me correct myself. It is integral. You cannot be trauma-informed if you do not honor that. So to gut that part of the policy, but to keep the trauma-informed language, to say, oh, we're trauma-informed, right? So just notice that. I'm just bringing this to your awareness. What you do with this is your choice, right? Just notice that this is happening. And in another one, in 2025, Missouri, the Missouri model, you might have heard of it, right? Notoriously, a school model that is supportive, is trauma-informed, and this year, there was an attempt to repeal it in the state that it was created. And I find it interesting, right? It's just an interesting noticing to see that the removal of any sort of shared statutory definitions of trauma-informed is gone. And you were talking, Samantha, about the importance of a common lexicon, right? Being able to coalesce around a message. Doesn't it make it much harder for progress to happen if we don't know what we're advocating for, if we don't know what this is, right? So these are things that we're seeing. We see the movement has a shared understanding that existed, and now it's becoming more fragmented. And I mean, it's a parallel process, right? We see this happening in other ways too. So just noticing that this field that we all are a part of, it is not exempt from the dynamics of what we see happening. And yet, I want to say, I think that the slide will advance. I advanced it. Let me see. Hang on. Maybe help. Suspense. Yeah, so it's a Viktor Frankl quote, right? It said, between a stimulus and a response. Ooh, thank you. That was a significant delay. Did you?
I literally did nothing.
All right, we're running on a delay just in case I'm a live wire. I know, you need to beat me or something, but we're running on a delay. Between a stimulus and a response, there's a space, and in that space is our power to choose our response. And in our response lies our growth and our freedom, right? And if you know a little bit of it about Viktor Frankl, that might give you some goosebumps as well, just to know the context too. So I really want to invite you to notice, right? This is a pivot point. We are at an inflection point, to use a buzzword, right? We can make the choices. There are choices. One of the things that tools of oppressors, one of the things that oppressors do, right, as a tool is to tell you you have no choice. There is no agency. You just have to accept it. No, you don't. We're all here to tell you today, and we're going to tell our legislators today, no, we don't. We don't accept it. You don't have to accept it. We can make a choice from saying, like, well, I know this is happening, and I see, and I'm writing letters, and I'm doing the thing, to really collectively coming together to be intentional designers. We get to co-create. This is the first of many conversations. We get to determine what the future looks like. We are building that. What an opportunity, because we got to rebuild. There's a lot to rebuild, right? And we get to choose what that looks like. What we do today shapes what the future becomes. And so I'm going to go ahead and just share a few overarching ideas to bring it to Sandy, because there's a bridge that is leading, right? And it actually is in this room. You all can't see it, it's leading right to Sandy. So this idea of erasure, right? Collective memory being erased on purpose. It is a tool of oppressors as well, right? We need to remember, we need to talk about it. We need to make sure we are honoring lived experiences that we all know happened, and not let collective gaslighting make us forget our truth and our humanity and disconnect us from one another, especially. The narrative distortion, right? We know, I'm a therapist, so I know the importance of memory reconsolidation and restoring and revisiting, walking around that labyrinth, and each time the scenery looking a little bit different because you know something more, you've learned something more, you've integrated something different, and you can act differently, you can respond differently, right? So contextual integrity, really being, having that integrity to notice that when trauma is separated from its causes and context, right, there's no policy that is going to be able to actually do anything if you are divorcing it from what it really is and what it really means. The collective dissociation, Sue and I did a cool talk about this, not to plug it, but I think I'd like to plug it because I think it's a conversation that those of us in the room might be having, but people are in the out there might not be. We see a trauma response that is happening. We know what that looks like. We see the disconnection out of survival. We see the fear, the uncertainty, the doubt. We see it. And not everybody does. And so we get to bring awareness to what that is, because when you know what that is, you get to make a choice about what you do about it, right? So instead of the dissociation, let's choose collaboration and coordination and connection and gentle compassion and curiosity with one another to understand what's happening and call people in when we see it. And again, that fragmentation and reactivity, integrated, bringing it all together. We are all interconnected. That is how we are in our nature. It is not our nature to be as we are now. So just remembering that, remembering your own humanity, coming back to yourself, coming back to one another, to be able to shift this together, because that collective action is the only way, right? And they don't want you to be in this room today to do that. Power, right? I'll plug it again. I came full circle. I didn't even know I was going to do it. Power is so important, and we get to have it because we are coming together and talking about these things and doing things. And yeah, I think that that's really the important thing to remember here, right? So I'm just going to go ahead and leave it at that. I'm going to pass it to Dr. Sandy Bloom with so much gratitude for your time, your space, your systems, your courage, and your energy for being here. So grateful.
She talking?
Sandy, if you are speaking, you are on mute.
You're muted.
Hold on.
Might be our volume also.
No, she looks like
So we see the microphone. Sandy, can I unmute you?
Yeah, there you go.
Can you hear me?
Yeah, there we go.
Okay. Hi, everybody. Thanks, Whitney. And then what's ironic about this is Jesse asked me, said, I'd like you to take 15 or 20 minutes and give the history of trauma. Well, that's not possible, Jesse. I can't do that. And so I had to decide, what could I talk to you about that is really what history reveals. And I feel like what I want to tell you is part 3 of what Samantha and Whitney just did. And that's very gratifying. Because I think what we're really witnessing, all of us, and a part of, is not just the growth of a field, but we are living through the early stages of a paradigm shift. And a paradigm shift is not just new information. It's a change in everything, in how we understand reality. And the paradigm we've been living in, all of us have grown up in, has treated human beings as separate individuals, problems that are isolated, and systems that are machines to be fixed. And it comes out of, first, the Copernican revolution, so where we found out the Earth rotates around the sun, not the reverse, and that led to the Enlightenment, originated in the 1500s, and that liberated science from religion and all kinds of false beliefs. And that led then to the Industrial Revolution and the mechanistic universe that we live in today. And paradigm shifts, just as Whitney was just talking about power, paradigm shifts are mightily resisted. Bruno was burnt at the stake. Galileo was confined to his house. Bad things can really happen to people when we are trying to shift paradigms, but we desperately need to do this. So we need to understand what we're in first. And we are in a model within which all of our systems are based on machines. So the machine model assumes that systems are made up of parts that can be controlled, they can be made more efficient, they can be optimized, they can be fixed without impact on anything else. I'll give you a couple of examples of ones that you have experience with right now. You can see it in healthcare, where people are treated as collections of symptoms and billable hours, rather than whole human beings who are embedded in relationships. You can see it in education, where children are measured and standardized as if learning could be on an assembly line. And that's really what kids were being prepared for. You can see it in organizations where people are treated like roles or functions, interchangeable parts, rather than as human beings whose capacity depends on the well-being of the whole system. And you can, of course, see it in their justice system, where behavior is punished without understanding any of the conditions that produced it, much less how to restore people to any kind of integrity or health. So across all of our systems, the same assumptions are operating, that human beings can be understood and managed like machines. The problem is, human beings are not machines. We are living systems. Everything, every place we work, everything we create, including our society, is a living system. So the paradigm that we are currently in is no longer adequate to deal with the problems that we face, which is why everything is falling apart. Now, we need to understand how we got into this. And to do that, we have to go back to deep time to figure out what we forgot. So, Homo sapiens have been around 200 to 300,000 years. That means, for all of you in the room, that means about 8 to 12,000 generations of your ancestors have spent 95% of their time living in small, interdependent groups. We were hunter-gatherers. And in those groups, children were not raised by one or two parents. They were raised by lots of people, whole networks of care. So if there wasn't a perfect match, there was somebody there for you. Emotional life was not managed alone. We were co-regulating each other all the time through constant interaction. People lived embedded in relationships with each other and with the natural world. And in that context, what we now call regulation and attachment and reciprocity and even morality were not ideas. It was just the way we lived. That was what worked. So we didn't evolve to be isolated individuals. We evolved as participants in living systems of relationships. And that is the way of being we have largely forgotten. But not lost. We've just forgotten it. Why did we change? What happened? Well, that's a pretty interesting question. What happened? Whatever happened 10 to 12,000 years ago. So before that, things were really different for us. That was the end of the Ice Age. And it was a lot about climate change. In the Ice Age, things first got warmer. And in fact, the biblical version of the Garden of Eden story, the fall, take the Eve out of it and take the snake out of it. It probably was related to what happened when things got too warm in the so-called cradle of civilization. Because what was the Sahara Desert now was a beautiful, fertile area back then. And that desertification happened all over the globe in different regions. That we started farming. That meant settling down, but that meant more population pressure. That forced people to compete with each other for resources and to organize ourselves really differently. So our groups became larger. We couldn't rely anymore just on face-to-face relationships to regulate our behavior. We needed new forms of coordination. What did we get? We got laws, we got hierarchies, we got institutions. And over time, a very different way of understanding the world began to take hold. A way of thinking that really emphasized separation, control, and predictability. And this way of thinking, of course, became incredibly powerful. That's where we get empires from. It made a lot of advancement possible. It made for medicine and technology and large-scale organization, but it came with a cost. In learning to control the world, we started losing sight of how we are connected to each other and to all the other life that is on this planet. So what began as adaptation to increasing complexity gradually became a way of seeing everything in a different way, including ourselves. So the tragedy about that is not so much necessarily that we adapted. The tragedy is that we forgot we were adapting. And it's within this shift that we begin to see trauma. Now, of course, trauma happened to people before that, but now it becomes incredibly widespread and organized. There's actually, you probably have not studied this in school, but there's very little evidence, as it turns out, that before 12,000 years ago, human beings led violent lives. There's just no evidence for it. And that's probably not what you were taught to believe. But it is a very convenient mythology for those who want to disempower other people. Oh, that's who we naturally are. That's what we always were. 12,000 years ago gave birth to war, social inequality, gender discrimination, and child abuse. Yeah. So if you look then at the history of trauma, as Jesse wanted me to be, you can see this unfolding.
You're doing great, Sandra.
Okay. You can read about it in Gilgamesh, through ancient times, through the Middle Ages. It's in Shakespeare, and right into modern times. So trauma was really first paid attention to in soldiers, beginning with the American Civil War, soldier's heart, nostalgia, World War I, shell shock, World War II, battle fatigue, and Vietnam PTSD. And then in survivors of war, of genocide and disaster. And finally, in 1998, we get the huge breakthrough of the ACEs research, because I contend all of this goes back to the way children are treated. And now we know the outcome of that. We know what happens to adults. We know our diagnostic system that we use. I'm a psychiatrist, but the DSM sucks. And, what happens is that adults develop what we call now complex PTSD and all kinds of dissociative problems. So over time, we've also gotten to know something even deeper that's really clear, that trauma is not rare. It is widespread. And that's important to convey. There's not some small segment of the population we can focus on. 75% of people at least will experience a traumatic event, and a substantial a number of people more than one. So it's embedded in childhood experience, in families, in communities, in the systems we depend on. And it's not just an event. And that's so what both of our presenters were talking about the problem with language. It affects mind, body, relationships, everything. People get stuck in repetitive and often very self-destructive cycles. It's a disruption of relationship and of the capacity to regulate ourselves, because we come with emotions. And then there's also a pattern of forgetting. There's something else when we look at the history of trauma. We keep discovering it and then conveniently forgetting it. It was recognized in soldiers, and then it was dismissed. It was recognized again after war, and then it was pushed aside. Freud saw it as initially as a source of all neurosis, and that got pushed aside. it was recognized in survivors of abuse and then minimized or denied. I was centrally involved in the whole false memory syndrome bullshit. And again, we see the same pattern. We recognize the impact of overwhelming experience, and then we turn away from what that recognition would require of us. Because to fully understand trauma is not just to understand individual people. It's to confront the conditions in families, in institutions, and in societies that produce it, like our political system, like our religious beliefs, like our economy. And that is way, way harder to face, particularly when we are, as we are now, so profoundly divided. But forgetting is not accidental. It's a part of how power protects itself. But it does determine repetition, which we call traumatic reenactment. Now, there was a guy, and I'm in the process of writing a book about him, that lived 100 years ago. He's a psychiatrist. He was, in fact, the first American-born psychoanalyst, and his name was Trigant Barreau. And he was analyzed by Jung, but a patient that he was treating, who was a helper of his too, who was from, I'm proud to say, Pennsylvania, challenged him in the middle of his analysis. And he said, basically, look, if this thing is really valuable, we could switch places. And I could be the analyst and you could be the patient. And I have not figured out yet exactly why he did this, except for he was a curious, brilliant man. He switched places. And what they discovered together was that authoritarianism lie at the root of what they thought they were actually doing. And they worked together with a whole lot of other people, friends, colleagues, family members, after he got thrown out of the analytic societies, which he did, to figure out, what is this about us as a species? What's going on? Why do we revert to authoritarianism? Why do we divide the world into two? He actually is the unacknowledged founder of group therapy. And he said, living systems regulate through relationships, not through control. And he believed that everything originated in the mother-child bond, and that we keep forgetting the importance of that, and that we literally forget about what it was like to be tied and not connected to another person. So challenging the powers that be came for him at a high cost, but he seemed to he just went on. He was pretty amazing. The thinking, the philosophy around thinking about living systems has been called organicism. And it's the understanding that life isn't made of separate parts. It's made of relationships. It sees human beings, organizations, and societies as all being alive, and that you cannot understand the parts by breaking down the whole. You lose something in the process. And you can't change a system by fixing one part in isolation. So a child's suffering is not just in the child. It's in the relationships around the child. And that brings us back to trauma. Because if trauma disrupts regulation and relationship, then trauma doesn't stay inside individuals. And you've already been talking about this. It becomes organized into systems. So you get trauma-organized families. You get trauma-organized organizations. You get trauma-organized societies. These are systems, then, that are driven by fear, reactivity, and disconnection. So that even when the people inside them are trying their best to do good, they inadvertently are creating actually more trauma, and a lot of traumatic reenactment, because they're trapped in these mechanistic systems. So I just finished 3 months of a break in writing another book about biocracy, which I hope will be a direction forward for governance, that it represents the evolution of democracy informed by biology and all we have learned about trauma and adversity. It means designing our systems the way living systems actually work, with attention to relationships, regulation, feedback, and development, instead of control, fragmentation, and reactivity, using the human body as the model. The word itself comes from a guy named Dr. Walter B. Cannon, who spent 40 years at the Harvard School of the Harvard Medical School. He was the head of physiology. He's the person, and it was in the first half of the 20th century, and he was a contemporary of Trigant Barreau, and they knew each other. He was the person who coined the term fight or flight. He coined the term homeostasis. He was in World War I, and then he did his very best to fight totalitarianism in Spain when the Republicans were fighting against Franco, who was being supported by Hitler. So in 1940, he knew what was coming, and he said he was giving the presidential address for the American Association for the Advancement of Science. And in that address, this is what he said. He said, the most efficient and stable human society would be a body politic modeled after the human body, a biocracy, in which the myriad of differentiated cells would be organized into functional organs, all cooperating in a dynamic democracy in which any form of dictatorship would lead to degeneration and death. Well, we need to be paying attention and changing our perspective to a different paradigm for how human beings actually function. And in a living system, health depends on this, depends on regulation, relationships, feedback, the ability to adapt, and the capacity to repair when things go wrong. And when those conditions are present, systems can grow and function. When they're absent, systems then get the way Whitney described. They get rigid, reactive, violent, and they eventually break down. So biocracy asks a very different set of questions than the ones we're used to asking. Instead of asking, who's the problem? Who do we fix? Who do we remove? It asks what's happening in this system. What are people responding to? And what conditions do we need to create for this system to function in a healthy way? So in a biocratic organization, leadership is not just about control. It's about maintaining the conditions that allow people to function and relate effectively. In a biocratic school, the focus is not just on performance, it's on creating environments where kids can regulate and co-regulate and connect and learn. In a biocratic justice system, the goal is not punishment, it's repair, restoration, and the prevention of further harm. So biocracy is a shift from controlling parts to cultivating whole living systems. So now, Jesse asked me to make sure I ended with some hope. So I wanted to say something about hope. Because I don't know about you, but I don't find it very easy to feel hopeful right now, not with my country falling apart. But hope doesn't come from pretending things are better than they are. And it comes from understanding something really important. That if our suffering were only inside individuals, we would have very little power to change it. That's part of the dilemma of treatment. It's really hard to get people to change when they are really stuck. But if suffering is being produced by the way our systems are organized, then something else is also true. we can reorganize them. We're not starting from nothing. We are remembering something very, very old, how human beings actually evolved to live, and integrating it with what we know now from all that we've learned about trauma and adversity. We don't have to invent a new way of being human. We have to remember one. If trauma can be organized into systems, then healing can be organized into systems as well. And I will leave you with that. Thanks for listening.
Thank you. Thank you, everybody. I recognize that that was a rich, incredibly wealthy amount of information throughout all three presentations. And I'm so grateful for everyone that is here with us in the room, as well as the virtual room, and for our three wonderful speakers. And our four wonderful.
Our five.
Sometimes I forget to count myself. We'll get to like a conversation at this point. Want to honor if folks on the line, we recognize that we said 5:30 to 7. Folks in the room, folks on the line. There is agency throughout for anybody who wants to continue on with their evening, right? But we will continue the conversation for a bit as well. And then for folks that are here in the room, we can also get dinner and then come back up and keep it going for a bit. But just want to start, if it's okay, by recognizing that 10 years ago, it was not this exact room. It was at the law offices of Van Ness Feldman, most recently visited by Tammy Dakota, back on Thomas Jefferson Street, because I did not do a good job of communicating the new office versus the old office. So appreciate you getting to see the whole history of Van Ness today. But it was 10 years ago that a conversation in a boardroom, not quite as modern, but very similar to this, in the law offices of Van Ness Feldman, that conversation began amongst 25 or 30 people that started the campaign for trauma-informed policy and practice. And to see 10 years later, certainly with a mission to create a trauma-informed society in which all individuals, families, and communities have the opportunities and supports necessary to thrive, there are some ways in which, given how our country and our world has progressed over the last 10 years, there is still a lot of work to do, and also getting to be back in conversation like this with another group of 25 to 30 folks that are in the room, 25 to 30 folks additionally on the line, and many more conversations to come that, as Sandy just sort of beautifully illustrated, there's so much hope for the work that's ahead today, for the work that we're going to be doing tomorrow, and again, the work that's going to emerge from there. I recognize that there's one question in the chat. For anybody else online who has questions, please feel free to use the chat. Sandy, do you mind restating the name of Trigant Barreau you mentioned? And then who's the gentleman who you mentioned who came up with the term biocracy?
Walter B. Cannon. Cannon.
Thank you.
And Trigant is TrigantBurrow. He was from Maryland.
Thank you. And so we will continue monitoring the chat for folks who are on the line if there are any questions, but I'll turn it over to you and also to the room for any questions or comments or thoughts that are emerging as this conversation takes off from here.
It was such a rich conversation. Thank you. And I could see all of it resonating with many of you. And so let's open the floor for just some thoughts, some comments, some response. Please.
This is so powerful. I'm so grateful to walk into this room. My name is Krishlana Evans, former Director of Creating Resilient Communities at Paces Connection. So great to make this pilgrimage from New York City this morning. There's something that has been really powerful in my own trauma-informed journey, work and life. Let's just say it's a double helix. That I'm also on joining with Sue, New York State Trauma-Informed Network and Resource Center. And what I love about that, there's a couple of programs they have, but one thing that really resonates in my own background is branding, marketing, communications, public relations, and the trauma-informed space. So they all kind of intersect, and these are informing me. But I feel like I am Tending the Roots certified. And I just want to put this on the table authentically put this on the table for everyone. I took this really wonderful 6-hour training with New York State Trauma-Informed Network and Resource Center, which is like, the New York State Trauma-Informed curriculum. Why do I love it so much? Like, I didn't even know why at first. Like, why am I so, like, the affinity was like obsession. And what I love about it is I've discovered something, I want to share it, which I feel there's a lot of silent, dominant caste supremacy storylines that live between the average person with lived experience, the person with lived experience who's also in the space, and then the people in the space that are just here with so much heart, maybe not with that lived experience. And I feel like that's something we have so much power to influence. I don't believe I'm the one to just show up and just deliver that and it magically changes. But I've had on so many occasions, like, well, how did you get here? Well, who invited you? And I'm like, well, are these the questions we're supposed to be asking each other when we're here with so much power to change things? So I wanted to share this because I felt like at Pace Connection, before they kind of gave that back over to TSNE, people had such a great response to the certification program there. And so it was the certificate that was really rattling in the back of my mind that, I'm also here as a survivor of life-changing violence and feral policing during my childhood and over time. So I keep hearing the question, well, what do inner city does, and what do the housewives of Georgia do, and how can everybody get together? And it's like, that certificate, that's a personal contract. That's a personal gold standard of accountability that anyone can have in the public or private sector, whether that's Tending the Roots, whether that's the CRC or any of the beautiful and powerful programs you all have. You probably already know and understand what I'm saying, but I'm so passionate about that because so many people are tiptoeing towards expanding and then someone burns them up. Well, maybe you don't belong. You're not a doctor. And it's really like people I adore. I want to be transparent, like my upper echelon bougie buddies who are just convinced that if you're not this executive level, you have to get your PhD in order to start your healing journey. So I'm probably saying something and recognize, but I'm sharing my voice here in honor of someone who cannot be in the room, my sadly estranged late sibling, and I thank you so much for having me today. Thank you. Thank you. Thank you for being here.
And you pose such important points about the questions we ask and the way we look at one another to justify our space in the room, right? I mean, I think about how we went around and introduced ourselves and we were justifying our reason for being here in some ways, right? And so how do we move beyond that? How do we change our language to change that conversation? Because we know that when we're in spaces where we're welcomed in a different way, the whole conversation shifts. How do we do that?
I'm thinking about it. So I'm blown away here. From Sam to Whitney to say, I'm emotional. All I heard was back to basics and care about people.
That's it. You got it.
Fan, you my type of girl fan.
Free hugs. So when you come back, free hugs.
I have a general question. Maybe Sandy, you could maybe answer it or have some knowledge. One of the things as a clinical social worker, for many years, and we all know SMART goals, right? Mm-hmm. Even our organizations have them, though. Our public sector has it, our private sector has it. With SMART goals can come some adversity. There is some harm, as well that has to be identified. And I feel like we leave that to the wayside. We never identify what that fog might be or could be happening from that goal and say, no, this can't happen, or what's the alternative? Because we kind of keep just sliding through on that goal and wanting to accomplish it. Even, if the goal is trauma oriented or whatever, it's like, when do we stop it from a macro, meso, micro level of saying, okay, the fog of the harm, where is it? Is it here now? And when do we identify it? Because I feel like as a clinician, revising goals with our clients, we do that often too, how often does that truly happen in organizations and the justice system and being, transparent about it?
Exactly.
Yeah, that's why, that issue is why it's okay for me. Can you hear me? Right?
Yeah. And then we have another person in the room that will follow you, Sandy.
Oh, okay. Never mind.
No, go, Sandy. We're waiting on you, Sandy.
Oh, okay. That question, that issue where, that's what I like so much about Barreau, was that the people in his groups, they were, instead of blaming each other, they were using their own individual feelings and experience to look at, what is it with us? Why do we keep doing this stuff? Why do we keep that? It's universal. It's not just one screwed up organization. They're all going to be. They can't kind of not be because of the paradigm that we're up against. So we have to be able to talk together without feeling like we're pointing fingers and blaming. And the more we make it, the more we educate people that this is everywhere. This is a part of what's going on with humanity, then the more we're able to have those kind of conversations that are not just about finding somebody to blame.
Please.
Oh, thank you. This is, learn really important to me things. One thing that I'm confused about, so I don't know how this is going to come out. I'm very tired, but so too many other people have been, experienced, destruction from hierarchies and trauma and then at the same time, so hierarchies can absolutely, turn to, serious, just destruction and oppression, really terrible things. At the same time, what was that?
That was you, Edric.
Yeah. Somebody's mocking.
No.
No, that we're animals, and I see with my dogs, the dogs that they interact with, people with dogs, there's hierarchies. And so that's what I'm confused about how to, work with, trying to change the really destructive, abusive hierarchies, but also what I think is also, working with the reality that hierarchies are natural. I see it with, animals, and we're animals. So I just wonder about
I got a response that I have two dogs who are very eager to go out right now. But so I know exactly what you mean. But if we use the model of our bodies, really, who's in charge of your body? You know, what's the hierarchy in your body? Like, if you drop a gallon jug on your big toe, how's your thinking going to be? Not so good, right? So the body, actually, it's information that's being transferred constantly and feedback that's always there. And every part is essential or we die. So it's a different model for humanity because we are maybe we're not as adaptive as viruses are, but we're pretty damn adaptive. We can adapt to pretty much anything. And so we don't have to follow the same rules that other animals do. And there's great variation in the mammal world. It's not just dogs. There are some mammals where women are superior. Sorry. But for us, I think the best model that we use for organizations is to really know more about how the human body really works and then base how we function on the human body. And that was something this guy, Walter Buchanan, was talking about. And he said the leader is not the brain. The leader in an organization is the heart.
We have a question on our virtual platform. Please unmute yourself.
No?
We can't hear you. Here we go. Hang on just a minute.
Maybe she can type it in the chat.
Unmuted.
My ear is just really faint.
Is it like? Yeah. So it's very faint. Can you hear us? Okay.
Can you leave it?
Pardon me if I did not get your name correct there. Or if there isn't something on your microphone, or because it looks like you're unmuted, are you able to either put your comment or question into the chat? I know that is not fair and don't mean to make you distill a nuanced comment. Yeah, we're just not able to hear you, unfortunately. I'm sorry. But certainly want your insight and wisdom.
It is showing that she's muted though.
No.
I just went back.
Oh, she just went back.
Yeah.
Okay. The thing that struck me about, your comment and Sandy's response is that we didn't get here overnight. And it's how do we unlearn? How do we set environments? I mean, you were talking about that. How do we structure our environments to allow us to experience each other, experience circumstances in different ways? And how do we set up our environments in such a way that can happen?
And how wrong are we? Like going back to Renee's, discussion about we're losing sight of the goal when we focus on the goal instead of how it is we're going to get there.
We lose sight of the harm that's being done.
Yeah.
Yeah.
But we're all striving for that goal. So in the meantime, like somebody said about hurting other people, I think it was Sandy, hurting other people, that competitiveness that we don't have to have.
Mm-hmm.
You can interrupt me if her question is already in the chat, but I wanted to add a yes and to these comments. I also studied various forms of wellness, shamanism, Reiki, voice dialogue, and I see a lot of potential with voice dialogue with people that are in the space of being caretakers or working in organizational settings, because oftentimes we have the information cerebrally or intellectually, but we're not friends with that constellation of inner selves, some of which hold on to maybe negative belief systems or ways to cope or seeing through the lens of a wounded inner child, etc. So not that, it's maybe in a client setting, you're going to start, kind of doing too much of that because obviously you're in that client setting. But I've seen such powerful transformational work, and I feel like something about the trauma-informed space sometimes can make us engineer like a trauma-informed persona if we're kind of crawling to the shore or kind of just struggling a little bit. And I feel like there's there's a lot more value in really having some space, wherever that might be, to actually meet some of the icky, scary inner selves that we can't put in the workplace, that we can't just readily share at the dinner table. I don't see enough of that. And I feel also like somewhere in there is this intersection of perfectionism, because the brain is right. Yeah. Instead of the heart and the body being an intuitive space. So I just wanted to share that because I feel like there's a lot of resistance with, it's considered scary. I'm like, how could voice dialogue be scary? Like actors and musicians use it. So I'm just wondering, like, how can we soften and make that something fun and wonderful? I mean, it changes lives and it creates a space where we don't have to engineer empathy. Mm-hmm. It's like just seeing someone kind of tapping into their own stuff. So that's maybe lofty or far-fetched, but I think it's fantastic. And I wonder, why are we resisting that collectively?
I would like to add to that, and others can react, is also that it's that recognition that awfulness that we believe only resides in ourselves, other people find that it's in themselves too. And so when you can begin to say, then recognizing that it's what we all fear. And so how do we recognize that we all share that fear, that it's only in ourselves that we have that?
We have a question in the chat.
Oh, good.
That Sue will read out.
Sue?
Yes, from the chat. Elizabeth, thank you for putting it in there. I'm curious about how we can get more involved with trauma-informed advocacy more broadly. I see how much this has affected our systems, especially within our schools, as well as within our families and in our communities.
We're all looking at you, Whitney.
Well, you already are, aren't you? Being here. And I mean that in the most sincere way. You already are by being here, you're being a part of this conversation, you're carrying this forward. There will be resource documents from this. Take something with you, go have conversations, right? Connect with people. That's how this spreads. If you want to write a letter, if you want to call a congressperson, fabulous. And also, that doesn't have to be your only inroad to advocacy, right? Making yourself knowledgeable, being able to sort of notice when someone might bring forward a perspective and being able to call them in and sort of invite curiosity and really have human conversations. I think to the point that has been made, right? The human empathy, being able to see one another as human and inviting people in starts with yourself. And so giving yourself grace and not thinking you need to do all of the things all of the time. What you're doing is enough. And thank you for being here.
I think it's really important too to underscore something Melinda said, which is that this is a long haul, and therefore educating the young, passing on what you're passionate about to the next generation, because they're the ones that are going to have to, it's like a relay race, right? And passing the baton is really important.
As the next generation in this room, on Monday I go back to high school, right? And this conversation has been so like, I don't know what the right word to put it is. It's been so helpful, I guess, in a sense, and meaningful. And I don't know where kind of to go now that I'm still stuck in high school right now, and I don't know where to go from here.
So can I offer you something? Just as a part of another group that recently did the stress resiliency and psychological first aid for youth, right?
Mm-hmm.
All they want to do is take it back to the administrators of their school that are making the decisions. You can also consider starting a group on your high school campus to work on trauma-informed efforts and activities, and then, you know, have an advisor. And then when administrators see that, they will hopefully, knock on wood, follow suit.
And I know that Laura just put it in the chat, but for those that are physically here in the room, Whitney developed an advocacy series that lives on CTIPP's website that walks through, there's an asynchronous video module and then also an ebook for different learning preferences. Both are very useful. Yeah.
Buckle up.
And different ways of thinking.
There's one specific to youth advocacy, very specifically.
There is also youth advocacy.
Yeah, she just put that one in after too.
Yeah, I don't see it.
Thank you, Laura.
We have a question online from Carrie.
Harry, hi.
You're muted, so just. I have gotten so much worse at reading lips.
Can we unmute her?
You'll have to translate for us then.
I've gotten worse, so I'm. Yeah, no.
Wait a minute. Yay, I did it. Woo! Wow, it is so good to see y'all. And I mean, I just can't even begin to tell you. Hearing Sandy Bloom talk about the biocracy, I can remember hearing about that the first time driving through rural North Carolina, and I told Jesse, I had to listen to this 3 times. It was so good, your podcast. But a couple of things, and Whitney, God knows, dear, it is so good to see you. I just wish I could give you a big old hug, and I'm so excited about the work that Jesse and I are doing with this coalition of groups that we hope to really rally PACE's connection back and more. But I want to share some things with y'all. There's a great new book that has just come out called Greater Than Gravity. This was an advanced copy that I read last summer, but I've got a whole box of them. How childhood trauma is pulling down humanity. And it's by Michael Menard. And I read it last summer and gave him some edits and whatnot, and some of them got in, some of them didn't. But this book is a masterpiece at I hope bringing awareness. That's the thing that I think it's going to do, because this guy is brilliant. And he has the drive and the funds and the capacity and the network to launch this book. And it became a bestseller in 2 categories on Amazon on day 1 when it launched last week. So this is great. This is great because this is going to help validate what I've been talking about since I got my hands on the ACEs study in like 1999 and flipped out, and then didn't talk about for like 4 years because it freaked me out so much until I started learning about brain science. But the other thing that I want to share that has just come out is, and I love this, the Gallup does the World Happiness Report, right? And it just came out, and every year that it's come out, I'm sorry, my dog wanted to get up because he knows I have food. But it comes out, and the Scandinavian countries are always in the top. And even Israel, with all the violence and trauma there. And Costa Rica went up as number 4. Finland's number 1. A couple of other Scandinavian countries, then Costa Rica, then something else, then Israel. United States is way down in 23rd. And the thing that is mind-boggling is that we in the United States are so freaking arrogant that we think we've got a lock on all this stuff, and we don't look at what other people are doing. I sent this book to Jesse and his mom. This book is How to Raise a Viking. Parenting Parenting Secrets of the World's Happiest Children, and it was written by the woman who wrote The Year of Living Danishly. She was a journalist in England. Her husband got this great gig going to Lego, working in Denmark. And she couldn't get pregnant in England, but she gets to Denmark where there's all this love and higgy and good, clean air. And she gets pregnant, right? But she writes about how the children there are not terrified and they're free to make mistakes, and the parents are supported, and the moms, have what we don't have, and what these countries that rank high, they've got paid family leave. They've got a healthcare system. They actually don't have, the great chasm in inequity that we have here. They don't have the racism that we have here. They don't have the arrogance. So I just would love it if we would focus more on how we get each other and the powers that be, the systems, to look outside. There was a documentary that the wonderful Michael Moore did about 12 years ago, and it was called Where to Invade Next. Yes. Sandy, I love that you're nodding. I would love...
I use it in my course. I have the...
It's the best. I mean, he shows, we think we've got a lock on all this stuff, and he goes to Italy, and people have a life. They work, but it's not their life. People go, they go to Finland, and in the prison system, people are not treated like animals. They are reformed. They're given an opportunity to grow. They go to France. The kids don't eat the crap left over from the U.S. Department of Agriculture's cheese stockpile. They get the best food that there is. We are so full of shit in this country. We are the most arrogant, full of crap as a Christmas turkey bunch of bullshitters in the history of the universe. That if we don't look outside of ourselves, I just have this vision of someday Sandra Bloom, Heather Cox Richardson, Michael Menard, and maybe even Bruce Perry, that we have this webinar in the reconstituted PACES connection and talk about, since Bruce said so eloquently, to understand trauma, you have to understand history. To understand history, you have to understand trauma. And, it's amazing to me. And so here we stand, as per Sandy, talking about what happened 12,000 years ago with another climate crisis. And where the hell are we going to go with it now? We've got so much information. It's like, how do we leverage this so that we can get back to our humanity? Mm-hmm. How do we get back to the point that we can be present? The book by Michael Brown, The Presence Process, that Christina Bethel loves that book. So that when there's a rupture, there can be a repair. Because there's so many ruptures and there's so much repair to do. So anyway, I just am elated that I got to be here today. Y'all, there was a great trauma-informed healthcare researchers and educators meeting today for PACES Connection with that coast-to-coast group of people in medical schools that I was so excited to get that started on PACES Connection so that maybe we could help people in medical schools not learn racism. In medicine. Sandy, you know what I'm talking, racism is taught in medicine. Racism is at the core of all of this. That is our single greatest trauma, that we think that, it's like Rianne Eisler, so brilliant, domination societies. If we could do the partnership. So anyway, thank y'all for letting me just download the frustration.
Yeah, and remember, it's only 12,000 years old.
Right. Yeah, but how we change these systems, because it's the systems that keep perpetuating. So I love that there's energy here. And as Margaret Mead said, what, a small group of people change the world. That's the only thing that ever has. Amen. Love you guys. Thanks for letting me share.
Thank you.
I want to recognize that Ari kindly put the comment in the chat, so please, Sue.
Yeah, and thank you, Carrie, for all of that. Ari, thank you for putting it in the chat. She says, what I want to say cannot fully be captured in a chat. I come with lived experience in over 30 years of walking through trauma and helping BIPOC women do the same. I've taken many peer support courses and am currently certifying my nonprofit as a trauma-informed organization using my findings. Not a new concept, but a proven ecosystem because our trauma is very different. We are not always fully represented in these spaces. Culture for me is not an add-on, it is life. And Sandra, what you said is exactly how my organization was designed from the heart. We create community restoration specialists.
So I gotta say this because I was a little full then, but then Carrie spoke, and then as Sandra talked about mechanistic, right? And I started to think about, and you're talking about 12,000 years old, and I started to think about theory, and I started to think about Taylor, and I started to think about Fayol, and I started to think about classical organizational theory, and how we were looked at as machines, right? To just be productive, and it pulled together what Carrie talked about as a Black woman. Right, as a Black woman, and we talk about racism, at the end of the day, the division and the separation is necessary, and it's needed to keep for the power imbalances to stay in place. And they drive that, right, at the end, even those that don't believe it. Even those that, this is my colleague, right, that can say, I don't believe in racism. I love Tanya as a person. I love Tanya as a human being, right? But then you have people that won't stand up and say those things and be accountable themselves, why their power and their privilege is going to be questioned. They don't want to lose it. So the division and separation, it's the racism ain't going nowhere. It's not going to be eradicated. But when you talked about hope, Sandy, how can we start to bring that awareness to start to diminish, right, the racism? I believe that racism brings about trauma because, again, it's the division. But it's not so much about the racism. It is, again, the lack of humanity and just caring about the person that's sitting next to you in the room. No matter how they look, what they have, how they love, who they love, where they live, what they drive. Because at the end of the day, I'm a Black educated woman, but there are still individuals out there that are not going to see that about me simply because I'm Black and I'm a woman.
Mm-hmm. Yeah. Yes.
So when we talk about trauma, we all have it. I've always said in clinical practice that trauma, it's the root of everything. And you just said that as a child. You talked about the mother and fetus bonding. It starts there. But we are just so inclined to go along with the norms. It's all it's social constructions. And we're leaning into that. I'm with you. I'm happy to be in the space because I feel empowered. I've never felt defeated because I've always had to be resilient, forced to be resilient because, again, I'm a Black woman. However, I understand that it's not always about the race. This is simply about morality or lack thereof. And just being a decent human, I'm not gonna cuss, even though Carrie and Sandy was cussing in my colleague. I'm trying to be a good representation of my agency, my institution. So I'm do it when we get in the Uber. This is just about humanity, caring about people, no matter what. No matter what.
Very good.
You know, something you just made me think of was there's a TV show on now called Shrinking.
Yeah.
And I think it's really wonderful. And it's about friendship. It's about people relating to each other. 3 of them they're psychologists. One's black, a black woman, and an older one, Harrison Ford, the older white guy, and then a younger white guy. But then all of their friends and their family and their patients. And it's got a lot of power regarding what you're talking about. The way they've portrayed that, the way they've portrayed those relationships, the way they're overt about the racial stuff and the gender stuff. It's watch it. I think, and it makes you laugh, and it deals with grief, and it deals with male friendships, which you never see. You never see that.
I would add to the morality, it's power and fear.
Yeah, I'm conscious of putting my voice in the space. I don't want to take too much space, and yet when I hear you say this, I'm reminded. And a couple of weeks ago, I had the great privilege of seeing Dr. Ibram X. Kendi speak about his new book. And he wrote How to Be Anti-Racist, but he has a brand new book called Chain of Ideas. And he was speaking
what, Whitney?
Chain of ideas. Chain of ideas. Chain. CHAIN. Sorry, I'm a mush mouth.
Got it.
Chain. He was speaking very much, right? It might as well be called chain of conditions, because it's about the context and conditions that set this up. And at the end, he follows the Great Replacement theory and talks about through millennia all of these different cycles that we've seen before, and it ends in this idea of chain of humanity, right? Because that's the counter. The chain of ideas exists, the chain of conditions that have been harmful exist, and also the chain of humanity is unbreakable if we allow it to
be unbreakable.
That's right. That's right. Yeah. So just a plug for the book. I have read a little bit of it. It's been really generative. And yeah, sorry to spoil the ending, but I think it's a good right. Like I think the ending is that we're humans together and we can rise above.
Yeah. Well, it's time to wrap up, but I want to thank all of you for coming to this space with us today, for engaging in such thoughtful conversation. So thank you so much.